All right.
All
So,
right. Thanks, Mandy.
yeah. So, one, you guys will, I'd be shocked to learn that I have a lot of very strong opinions about pregnancy and exercise. And the US has finally gotten on board with the rest of the world and is being a little more reasonable about their recommendations. So, I'm less grumpy about what we're doing in this country. I have nothing to disclose. We're going to go through some of the risks that people think um, could be associated with exercise and pregnancy and really aren't, and then go through kind of the benefits of exercise during pregnancy. So some of the normal physiologic adaptations that we expect in pregnancy is that everything that you do uses more energy. So walking up the steps when you have, a parasite sucking, some of your nutrients and adding weight that is not, when you gain weight from exercising and gaining muscle, that muscle is useful and helps you go up and down the steps faster. And so you may potentially use less energy, even though you weigh more. When you have a baby growing inside you, that baby just takes up space, adds weight, and you have to do more work. So there is increased energy cost. It doesn't affect exercises like bike riding or swimming, but it does with walking and running. There is a maternal fetal temperature gradient, which promotes fetal heat loss. And so, again, we'll talk about some of that more later. There is increased resting heart rate and decreased maximal heart rate, which this is more important when you're talking to sort of high achieving female athletes. And we'll talk a little bit about them later as well, just to get that, like, you're not going to improve any of your PRs while you're pregnant. So sort of adjust your expectations for exercising while you're pregnant. It's not going to make you better, but you should be able to do it. So one of the things that people are worried about is when you exercise, you increase your core temperature and therefore could potentially cause fetal harm. They've done actually some decent studies on this, measuring core temperatures in women while exercising, and they have not been able to consistently ever achieve teratogenic levels, which are above 100.2. And no study has ever demonstrated an increased rate of fetal anomalies in people who exercise. And because of the diminished heat stress during pregnancy, the increase in blood volume, increased ability to send blood to the skin to dissipate heat, this is really not a risk. This is theoretical. They have demonstrated, that you can reach these temperatures with hot tub use. So don't sit in the hot tub for hours at a time every day. Again, concerns that, when we exercise, you send extra blood flow to your working muscles, and therefore you could divert blood away from the uterus and therefore potentially decrease blood flow to the fetus. The data is a bit inconsistent, and as you can imagine, it's not the easiest thing to study, but what has been done showed no decrease in umbilical artery blood flow, and one that showed a little bit of uterine artery flow decrease, but that after exercise, there's actually an increase of blood flow to the uterine artery. So you probably make up for any decrease that happens during your brief period of exercise. Fetal heart rates may increase with exercise. One study showed a little bit of a decrease in fetal heart rate, but it resolved in less than 2 minutes. And so there's probably, as far as the data goes, we have no concern about whatever decrease in uterine blood flow may occur with activity, because you make up for it afterwards, and it's a short enough period of time that it's not an issue. Again, is your use of glucose, when the increased energy expenditure that happens while you're exercising, could that potentially limit the availability of nutrients to the fetus? So when you're exercising, they have demonstrated some data where glucose levels may go down a little bit while people are exercising, which, as we will talk about later, is beneficial because it decreases your risk potentially for the development of gestational diabetes. But there have been no demonstrated decreases in fetal growth, no increased risk for gestational age or low birth weight. Some studies showed slight decreases in fetal fat mass overall in women who exercised, particularly in people who exercise a lot. But again, there's an increased delivery of glucose after an exercise bout. So there have been no issues with fetal nutrient supply demonstrated. there have been concerns that exercise could potentially increase your risk for preterm labor. About 10% of US births are considered preterm overall. So could the decreased uterine blood flow or catecholamine release cause contractions? As you can imagine, we can't really measure contractions while people are running, because if you put a toca dynamometer on people and they're jumping up and down and it's moving, you can't really measure it. But there have been no increased rate of preterm delivery in exercising women. And in fact, some studies have shown a 20% reduction in women who exercise for preterm labor. So if anything, it is protective, though the studies are mixed, most of them showing no difference, but a few showing some reduction in the risk for preterm labor. And then fertility and defects, the infertility rates are the same in exercisers and non-exercisers. Spontaneous abortion rates also the same. Congenital anomalies and placental anomalies, all the same. But a lack of first-term exercise may increase your risk for gestational diabetes, hypertensive disorders during pregnancy, excessive weight gain, and depression, all of which we'll talk about more later too. And then concerns about injury to the mother and fetus. So we know you get some more ligamentous laxity that could potentially increase injury. So people question, are you more likely to get an ACL injury? And there have been very few injuries documented to women exercising while pregnant, 0 ACL injuries documented. And some of that is likely just that, by the time that is a risk, you're really not, it's not like you're playing high-level soccer when you're 32 weeks pregnant, because it doesn't make a lot of sense. And there have been no reports of fetal injury, no documented rupture of membranes or abruption with people who are exercising when they're pregnant. So it's really, there have been no reported cases and no studies that demonstrated that there's any increased risk. So what are the actual benefits? So the incidence overall in this country of large for gestational age babies. So just you family medicine people probably know this better than we do. So large for gestational age means greater than the 90th percentile, and macrosomia means greater than 4,000 grams. So some of the studies use LGA and some use macrosomia, and where they actually document which ones they're using, I'll point it out. So the risks for giving birth to a baby with who's large for gestational ages, there's well-documented increased risk for operative deliveries, increased risk for shoulder dystocia, birth trauma to the mom, and postpartum hemorrhage. So LGA is bad. With exercise, again, there's always mixed data for all of these studies. And the problem is they use, like some of the studies use only overweight women, some use only healthy women, and some use a mixture. And then the type of exercise used varies amongst the studies. But when you're looking at large meta-analysis, again, despite the data being mixed, there is a decreased risk for macrosomia and large for gestational age. And it goes, you can see wide ranges, but never has a study shown that exercises increases your risk for large for gestational age babies. So that it's either no difference depending on the type of exercise you use and whether you're obese to start with, or there is a significant benefit. But in none of these risks have we ever seen anything that shows that exercises increases your risk for any of the things that we're talking about. In the studies that have been done, doing early exercise only and then not doing late exercise does not seem to reduce your risk for LGA. It's best if you do exercise throughout your entire pregnancy. If you're only going to do it during one part of your pregnancy, doing exercise late in pregnancy has more benefits than only doing exercise early in pregnancy. But the moral of the story is you should exercise the whole time. Exercise and gestational diabetes. So we know that gestational diabetes increases your risk for macrosomia, hypertensive disorders during pregnancy, birth trauma, neonatal hypoglycemia, and then diabetes for the baby later in life, as well as for the mom later in life. So in patients who have gestational diabetes, exercise improves glucose control and decreases insulin requirements, both aerobic and weight training. And if you combine the two, the glucose benefits are even better. So aerobic and weight training in people who have documented gestational diabetes improves their outcomes. Initiating exercise during pregnancy or being a healthy person who continues to exercise through pregnancy decreases your risk for development of gestational diabetes in many studies. Again, some show there's no difference. There have been no studies that demonstrated that exercise increases your risk for gestational diabetes. So there's, depending on the studies you look at, 28 to almost 60% reduction in the various groups, obese, overweight, and previously healthy women. There is a dose-dependent response that's noticed, which makes you think that this is an even stronger association, right? So for a 25% reduction, you need about 140 minutes of moderate intensity exercise a week. If you do 150 to 180 minutes of exercise a week, there was a 90% reduction in the risk for development of gestational diabetes. For hypertensive disorders, again, for preeclampsia, there's mixed data. There's zero evidence in any study ever of increased risk, but not every study showed decreased risk. But there have been studies that demonstrated up to 41% reduction in preeclampsia and 19 to 39% reduction in the risk for gestational hypertension. Most of these studies that showed a benefit, you had to exercise at least 3 days per week, preferably more, and at least 25 minutes per session. And it's more effective in women who are previously healthy. So if you go into pregnancy healthy and you continue to exercise or start to exercise, you are at less risk. If you start overweight or obese, you are more likely to get hypertensive disorders, and exercise is less likely to decrease your risk. So the effects on labor and delivery and gestation, again, mixed. The only studies that ever showed that there were a decreased number of days of gestation just showed that people might have delivered up to a week earlier, never preterm. There were a couple studies that showed that exercises delivered a few days later. In the study that showed women delivered 4 to 7 days earlier, they all thought that was a benefit. They were all happy to be done with pregnancy a couple days early. So nobody thought that that was bad. There's probably not an effect on labor, though some studies have showed that women who exercise during pregnancy have a shorter labor and might be less likely to go on to C-section or have an instrumental delivery. The more you exercise, the more likely you were to have a reduction, particularly if you exercise in the second and third trimesters. But again, those studies are pretty mixed, and the evidence on decreasing your risk for C-section and instrumental delivery is not robust. But again, it does not increase your risk for any of those things. For low back and pelvic pain, very common to get low back and pelvic pain during pregnancy. People who exercise complain a lot less of low back and pelvic pain. So again, and a lot of people might think that exercising would increase your risk for low back or pelvic pain because you are doing exercise and you're putting pressure. You have more weight than you normally have to carry around. And so potentially it would make sense that exercise might increase your risk for pain, and it does not. And then in Europe, they actually had some, I think it was in one of the Scandinavian countries, we'll say Sweden, might have been Norway. There were some specific programs they did for pelvic exercises that were demonstrated to significantly reduce pelvic pain, and women who exercised during pregnancy missed fewer days of work compared to women who did not exercise during pregnancy. Missed fewer days of work due to low back and pelvic pain, sorry. Weight gain and postpartum weight loss, exercise has a huge effect. 50% of women in our country gain more weight than is recommended during pregnancy. If you start out obese, you are more likely to increase your weight, and obviously increased weight gain during pregnancy more than what's recommended increases your risk for gestational diabetes, C-section birth, birth canal trauma, large for gestational age, and postpartum weight retention. So when people exercise during pregnancy, there is significantly less reduction in gestational weight gain. Again, the results are mixed primarily because they're combining lots of studies that have lots of different types of exercise and people who start out overweight and people who start out healthy in the first place. Again, better to exercise more than 3 days a week, 30 to 40 minutes, 45 minutes per session, can decrease your risk for excessive weight gain during pregnancy. And the other thing that's really important for women who did not exercise prior to pregnancy, just counseling them to exercise at their visits is not helpful. That does not increase the likelihood that they will exercise during their pregnancy. Having them in supervised classes makes all the difference in the world. So in women who were already regular exercisers and wanted to continue to exercise, they will do fine if they hear that exercise is not harmful, exercise is probably helpful, and they can continue doing what they're doing. Those ladies will continue to exercise. But if they weren't exercisers and you're worried about their risk because they're already obese or overweight, you got to get them in some sort of supervised class, because that's the only way that they're really going to exercise regularly. So if you exercise during pregnancy, you're more likely to return to your pre-pregnancy weight faster. Most women who exercised return to exercise. And this was a study done in really motivated ladies who were runners and regular exercises ahead of time. They returned to exercise anywhere from 3 days to 8 weeks postpartum, and none of them had problems. 9 out of 10 had zero pain and no problems. And again, some people might have assumed that your abdominal muscles might actually be at risk if you exercise too quickly after exercise. But what they found is that the exercisers' abdominal muscle tone was much better than non-exercisers immediately and 1 year postpartum. So exercising, even if you have diastasis, exercising after you give birth does not increase your risk of persistent diastasis or abdominal muscle issues. So exercising is good for your abdominal muscle tone after giving birth. Self-image and depression, again, we'll talk some about the reasons why we might see this. There's a 13% prevalence of depression in American births. People who exercise during pregnancy have better self-image, fewer depressive symptoms, including postpartum depression. A recent randomized controlled trial showed a 50% decrease at 38 weeks and 6 weeks postpartum, and better if you exercise both pre and post. So again, there are some factors that might contribute to this, so if you have a person who has enough support that they are able to exercise 3 or 4 days a week during pregnancy and after pregnancy, is it really the fact that they have support that decreases the risk, or is it the exercise that decreases their risk? Like, that part, I think, is difficult to tease out. So there are definitely some confounding factors with how much exercise can contribute to your decreased risk for self-image and depression issues. But again, if we know that in non-pregnant people, exercise treats depression, and so I think it's reasonable to assume that the exercise contributes, as well as the support from the people around you that allows you to be able to exercise. There are no adverse effects on lactation. So you do not. The other thing is like, if anyone tells people to pump and dump because of lactic acid, that's a bunch of crap. Like, that is absolutely unnecessary. There is no change in milk production. It is helpful to stay hydrated, just like it is in people who don't exercise, but there have been zero adverse effects on lactation ever demonstrated. Exercise has not been demonstrated to improve lactation, but it also has no bad effects, even when people calorie restrict, if you're overweight. So for bladder control, so this is the one place where exercising while you are pregnant, you have worse bladder control during the 3rd trimester. So people who exercise during pregnancy they do have decreased bladder control while they are exercising, not during the rest of the day, but during exercise. And that seems to make sense, right? Like, there's a giant baby pushing on your bladder and you're running or jumping, and you're more likely to have loss of bladder control. But after delivery, there's a significant decrease in risk for urinary incontinence. So immediately after, exercisers had a 40% risk for urinary incontinence, whereas controls had 60%. And then a year later, exercisers had a 20% risk of urinary incontinence and control had 40%. And this is actually one of the things that we've talked a lot about in the women's group at AMSSM. 1 in 5 women who have been pregnant, and it's actually 25% in college athletes, have some urinary incontinence when they exercise, and we never talk about it. And like, I remember in college, everybody was like, oh yeah, I take off for a sprint. It's, that's no good. Like, it happens in a lot of women, pregnant or not pregnant, and we don't talk about it enough, and we don't talk about the treatment of it enough, because women just think it's normal and we ignore it and we don't do anything about it. So this is definitely something we could talk to people about more. And if it bothers them, we could do some pelvic exercises with them. So it's just something to remember, that urinary incontinence with exercise is common in exercisers, whether they're pregnant or not pregnant, and even when they're young. So for sport-specific types of exercises, walking is the most common form of exercise that people do during pregnancy and outside of pregnancy. Walking has definitely been demonstrated to improve the sense of well-being in pregnant women, decrease the number of complaints about low back pain and other pain and general depressive issues. Most of the studies on walking alone haven't demonstrated a change of maternal weight or change in labor. Some have demonstrated maybe, but not to the point of LGA or macrosomia, slightly increased birth weight because of the increased blood flow to the placenta after people exercise. But it is, again, not enough of an increase in birth weight to qualify as LGA or macrosomia. Weight training, we just don't want people weight training so hard that they're breath holding, and I don't really want people to do that in life ever. People know my feelings on that one. Weight training in pregnant people increases strength and flexibility. If you combine it with aerobic exercise, there's even more benefit. In stationary cycling, 25 minutes, 3 days a week, which, as you remember, was kind of the minimal criteria to reach for benefit from exercise, showed improvement in maternal fitness, but didn't have any other effects on pregnancy. Scuba diving so this may come up on the CAQ. Scuba diving, there are no good controlled trials because, who's going to take part in that? Shallow diving that doesn't require decompression is probably fine, unless it's occupation related. So, going on vacation and doing a little bit of shallow diving is fine. But diving at levels that require decompression, there are 3 to 6 times more risk for spontaneous abortion, congenital malformation, preterm labor, and poor fetal growth. So if it comes up on the CAQ, we don't recommend diving in pregnant people.
It was on the ITE.
Yeah. So they could do snorkeling. Snorkeling's fine, but we're not. And especially, there are people like marine biologists who dive as part of their career, underwater welders, that we should be telling them that they should not be doing these things while they're pregnant. And probably no one should be an underwater welder anyway, because they die all the time. For if someone comes in and asks for scuba recommendations while they're pregnant, or it comes up, and I don't think that this number would come up on the test, but you want to limit your dives to 30 feet. And if you do insist upon diving that requires decompression, you need to extend the decompression time by at least 50%. Again, the right answer on the test is don't dive. So if you're thinking about exercise prescription in a pregnant person, first, you should continue to exercise during pregnancy if you exercise before you get pregnant. If you never exercised before you got pregnant, you should start exercising while you're pregnant. A minimum of 150 minutes a week, which is, again, what we recommend for the population at large. 150 to 300 minutes a week is kind of the range. At least 3 days per week. The more exercise you do, the more benefits you have in pregnancy. Adding weight training to aerobic exercise or aerobic exercise to weight training gives additional health benefits. Do not give people a heart rate number. It's dumb. and you'll look dumb if you give people a heart rate number. Use perceived exertion as somewhat hard. The Borg rating of 12 to 14. Advise people to increase their calorie intake to accommodate for their exercise, like we do in regular life. Hydrating well before, during, and after exercise, just like we tell people who aren't pregnant to do. And there is no evidence that vigorous exercise is harmful. So even if people want to exercise more than somewhat hard or hard, they can do vigorous exercise. It's not harmful. It probably just doesn't, I will tell you for sure, it doesn't feel that great running 5 miles when you're 40 weeks pregnant. You're like, yeah, I'll tell you, my knees and ankles were a little more sore than usual, but it didn't cause any harm. So for women who are fit, they need to adjust their expectations. They need to think about this as they're maintaining their fitness level. They're not improving their fitness. They are, working on their mental health. Anything you can do. Like we all know crazy, high achieving exercise people. Like they just need to understand that they're just trying not to lose fitness while they're pregnant. Contact sports after the uterus leaves the pelvis, so around 12 to 14 weeks, probably not the best idea. What we consider contact sports at sea level are slightly different than what they consider a contact sport in the mountains. Lots of OBs in the mountains let 34-week pregnant people ski. If they normally skied and they're good skiers and they're not going to ski really challenging stuff where they're likely to fall, whereas sea level OBGYNs will tell people 100% you're not allowed to ski after 12 weeks. So that I think is more of a practical issue more than anything else, is just depending on where you live and what you do. But should you be playing, soccer or football when you're 34 weeks pregnant? Well, no, you know what I mean? Because there's increased risk for, trauma to your abdomen. Avoid scuba, avoid high altitude exercise. So if that comes up on the test, you do say to avoid high altitude exercise, but the studies that have been done don't actually support that. But I think the problem is that people feel like we just don't know enough. So this shouldn't come up on the test. For people who live at altitude and exercise at altitude in the first place, they're all fine. Like they just continue to do what they normally do. But moderate exercise at altitude, like if we're talking about yourself, people on this call, or your significant others, they're probably fine doing moderate exercise at altitude, even though we live at sea level. If you're going to do a vacation in Colorado, it's probably okay, but don't run a marathon. If people want to start exercise while they're pregnant, the recommendations are not dissimilar to what we tell people who are not pregnant, which is start with 15 minutes or so of exercise. Do it 3 days a week. Increase 3 to 5 minutes each week. The goal of getting to 30 to 40 minutes, minimum of 3 to 4 days per week. So it is no different if you're pregnant or not pregnant. The most well-tolerated exercises during pregnancy are pool-based exercises, whether you're doing aerobics or swimming or aqua jogging, yoga, walking, stationary bikes, and low-impact kind of aerobics. And all of these things are available in all of our communities. They're all available in your living room. I mean, people can set up a little aerobic step and not put any of the risers on it and do, an aerobic program in front of their television while they watch a show if they want to. So it doesn't have to be high tech. It doesn't have to be hard. All of this can be super easy. So when you are talking to people who exercise while they're pregnant, and the next few slides are all things that tend to come up on the CAQ. So if a pregnant lady comes in and says they're having hip and groin pain, well, you need to pay attention to that, because that could be transient osteoporosis of the hip with a femoral neck stress fracture. So that's bad, and we need to pay attention. The tricky bit is then what do you do to work that up, right? We don't like to get x-rays in pregnant people. We really don't like to get CT scans in pregnant people. And do we really want them laying on their back for 40 minutes getting an MRI? I don't know. I'm not really sure exactly how we're supposed to work this up. Probably, if I had to do it, I would talk to our musculoskeletal people and see if they could do a really limited quick MRI is probably what I would do if we had someone come in that I was really worried about this. And I haven't had this issue, but that is probably what I would do. That's definitely not going to come up on the CAQ, but just something to keep in mind. If a person who is pregnant and exercising has significant shortness of breath, like more than they're used to, vaginal bleeding, dizziness, headache, chest pain, obvious amniotic fluid leakage, or signs of a DVT, they should stop exercising and go get evaluated, which I'm not sure that any of these recommendations are any different than we would tell the general population that if you had any of these things, you should go get checked out. But this is the list of things that we should tell when you're counseling pregnant people who want to start exercise or continuing exercise. You need to tell them to watch out for this list of things. And I know I put way too many things on this slide, so don't say anything, Suze. I know it, and I did it on purpose because you got to memorize this slide. So I didn't want it on 2 slides. You have to memorize the absolute contraindications. One of these, like there will be a question of this on the CAQ. So I use the Canadians' absolute contraindications because the Canadians are more sensible than the people in the United States. And so the test will be, based on these guidelines. The US also includes all of these absolute contraindications. So if you have an incompetent cervix, like you can't exercise. If you're on bed rest, like actually, if I had been on bed rest, I probably would have done some biceps curls or something. IUGR fetus, triplets or more, persistent, unexplained second or third trimester bleeding, preeclampsia, uncontrolled hypertension in pregnancy, diabetes or thyroid disorders. The US guidelines don't mention the uncontrolled diabetes or uncontrolled thyroid disease. I put them in there because the Canadians include it. I think you would probably figure that out, even if the US guidelines don't say it. If people are actively in premature labor, probably don't exercise. If they have premature rupture of membranes, if they are a person who's at high risk for premature labor from previous pregnancies, if you have persistent previa, so previa after 28 weeks. Again, this one was not in the US guidelines, but it was in the Canadian, so I threw that in there. And then severe cardiovascular or pulmonary disease. So if you have a CFer who's managed to get pregnant, or you have someone with a significant congenital heart disease that's limiting their ejection fraction, then obviously those people we don't want exercising. And that's, again, that's so different than what we tell people in regular life. It's really not. And then also you have to memorize this slide, the relative contraindications, history of preterm birth, extreme maternal underweight. So if an anorexic woman has managed to get pregnant, and we're really worried about their nutrition, and in my world, their bone health, right? Because being pregnant and giving birth is actually not great for your bone density, nor is lactating. So if we're already worried about their bone density and we know that they're going to increase their weight, we're increasing their risk for stress fractures. So if someone starts out extremely underweight, then we worry about those. If they're having an arrhythmia or kind of a more moderate cardiovascular disorder, again, they probably can do exercise, but, we might be doing more lightweight things like walking or yoga, Pilates, mild to moderate respiratory disorders. If they've had recurrent spontaneous abortions, again, that's a relative contraindication. People are going to get a workup for that at some point, and the vast majority of time, it's got nothing to do with exercise. It's chromosomal abnormalities. So if there are documented recurrent spontaneous abortions due to chromosomal abnormalities, they're probably fine. If it is not that, if it's some hormonal issue, then probably you want to wait until you're going to be pregnant and stay pregnant before you go ahead and resume your exercise. If people have severe symptomatic anemia, twin pregnancies after 28 weeks, and again, remember that's a relative contraindication. If someone's feeling great with a twin pregnancy after 28 weeks and they don't look like they're at risk for delivering early, they can probably continue to do what feels comfortable. And then moderate cardiovascular and pulmonary disease. And, my guess, I don't think it's going to come up on the exam, but if you how do you tell the difference between moderate cardiovascular disease and severe? My guess is it's all done based on ejection fraction. So that's, from a just being sensible standpoint, that's how you would do it. That's not going to come up on the test likely, but just make sure you memorize these this slide and the absolute contraindications. Those are the main ones that you need to know. And these are my babies back when they were small and cute. Happy to answer any questions now or when you're studying for the CEQ.
I have a quick
Mandy.
question.
Go
So,
ahead.
I know like after exercise, you can have like a transient proteinuria that will typically resolve if once you stop exercising. Are you screening like pregnant patients that are more active, especially like with endurance, and they're kind of still pushing it to their limits for proteinuria, or like do you kind of take it with a grain of salt, knowing that it could be like
I
helpful in
wouldn't screen
diagnosing
them.
preeclampsia? Okay.
No, I wouldn't screen them. And I think people, I'm trying to, my OB did not. And I was pretty clear that I was still exercising every day and they didn't bother to check. I think they were doing, they checked my blood pressure and regular things. But I don't think that most OBs are doing that. And I guess if you were doing it to look for preeclampsia and someone did have proteinuria, probably you would do what we do in the regular population, is tell them not to exercise for a couple days, bring them back and recheck is what I would do practically, I think.
Mandy, can you address the not common but occasional situation where people may run into where they're a team position and a college athlete shows up in the training room?
Yep. So they actually have one
pregnancy?
at BW at Baldwin Wallace. Austin, you're dealing with this right now, right? Or have you not heard about her and Beer's taking care of all of it right now?
Beer is taking care of her, but I'm involved in on the emails and everything.
Okay. So this particular athlete is a swimmer. And so she's actually and not a diver. So if she were a diver, after probably 14 weeks, I would probably say no diving. Just because there's, that is a high contact, high collision activity. As a swimmer, she's safe to do everything. She is continuing, and she's, the swimming season is nearing an end or is already over. I don't know if states for high school is this weekend. I don't know when it's over for college people, but swimming is actually one of the safest exercises for people who are pregnant. And outside of the fatigue of the first couple months, so the fatigue could potentially affect her performance negatively. But if she's able to get enough exercise, get enough sleep, it may not even affect her performance very much. And the slight increase in blood volume could maybe increase her performance minimally. And there were some crazy, terrible, like East German studies way back when, where they actually were purposely getting people pregnant and then aborting the babies later because of that increase in blood volume to try to improve people's performance in swimming and running events. And it didn't pan out. And so they stopped doing it, thank goodness. But so for swimming, it's fine. For soccer, I would let people play in games probably until 12 weeks, as long as they were comfortable. After that, I would make them stop because of the collision. So, and same thing for like lacrosse, field hockey, any other collision sports, you have to stop once the uterus kind of enters the pelvis. Now, that said, I would allow them to, especially if their team, which for lots of athletes, their team is, that is their whole sort of support community. So I would allow them to go to practice and do non-contact activities, skills activities. There's no reason why you can't go to practice and do foot skills or warm up the goalie, or, you can certainly do line drills in lacrosse where there's no risk for contact. So if that's an important part of their identity and you're going to prevent them from being depressed by allowing them to continue to interact with the team, I think that is a very reasonable thing to do. And since, obviously, if you are a college athlete who's pregnant, most of the time it wasn't intentional. Sometimes I'm not saying all the time. I'm sure at BYU, sometimes it's intentional, but in a lot of cases, it's not intentional. And so they probably are very stressed and anxious and scared and sad. And if the team is a great support mechanism, then I would let them continue to interact with the team as much as is possible. Now, if the coach is being a complete jerk and is making them feel terrible, then maybe we want to pull back from some of those team activities. So I think you sort of have to assess whether involvement with the team is going to be helpful or hurtful psychologically. And, I think continuing to exercise 5 days a week in a way that's not harmful to you or the baby is a great thing to do.
Thank you.
Time.
So, I feel like we talked about so many of the benefits, and the only thing that I caught would be a possible risk factor when we're counseling pregnant athlete is that your urinary leakage could get worse.
Yep.
For that, I assume you recommend Kegels. Is there anything else that you usually do to help counteract it?
Kegels, and now you don't have to go name brand because they're more expensive. I would just tell people to buy the underwear. The Thinx is the most common one, I think. But all of the underwear brands that sell period underwear also, I don't know what the difference is between period underwear and leak underwear, but they all sell both. So I would just tell them to buy that just for comfort. And, for environmental purposes, that's better than using pads, and you're less likely, exercising as you get bigger, you're more likely to get some chafing potentially. So using the underwear, you're less likely to get chafing than you are using the pads. So I would just offer those sort of practical things of, particularly if you're going to exercise outside in the cold, you don't want your legs soaking wet. But also just reminding them that this is it's not just you, this isn't anything to be embarrassed about or ashamed about. This is just the deal. And after pregnancy, you will have a better chance of achieving, good bladder control compared to people who don't exercise. But 1 in 4 or 1 in 5 women have urinary incontinence with exercise, regardless of whether they've been pregnant or not, particularly with jumping and sprinting kinds of activities. So I think, the Kegels are great. And the problem with the Kegel exercises are that a lot of people do them wrong. So doing pelvic floor therapy is actually, even better. And if you go on Amazon, they actually have a ton now of the biofeedback devices for people. Every year or two, I just do a little search on Amazon to see how those are coming along. They're still pretty expensive. So women where there aren't a lot of financial restrictions can probably afford to go and buy one of those things on Amazon. Other people cannot. And if the insurance will pay for doing true pelvic floor therapy, it's probably worth it. Especially if it bothers them. Again, some women are just not that bothered by it. They're like, whatever, it happens, no biggie. And again, I tell them, if you want to fix it, let's do pelvic floor therapy. If you don't care and you're not going to do the exercises anyway, because you don't care that much, then don't spend your time or money going to pelvic floor therapy.
Makes sense. Got it. Thanks.
Thanks, Mandy. All right, everybody, have a good Friday.
Have a fabulous Friday, people.
Thank you.